control options on the market, things can get a bit confusing. So Lindy went to go see Dr. Elna Rudolph at Mysexualhealth to learn a bit more about what the options are.
All the girls are surfing away, surfing the crimson wave today.
So how does the Mirena work?
We put it into your uterus itself. There, it will release a small amount of hormone, a type of progesterone, and that thickens the mucus of your cervix. So then the sperm can't swim through it, and it looks like that. You can see if you look at your uterus there, that it has a kind of a triangular shape, and therefore we insert this, and then it gets hooked at the top of this triangle, basically. It will last 5 years, and it is as safe as sterilization.
I'm pretty sold on the Mirena, but what are the other methods that I could look into?
There are 2 more modern pills on the market these days that contain a very natural estrogen and a progesterone that's closer to natural. But you have to remember it every single day. If you don't remember it, you can fall pregnant if you take antibiotics, or if you have vomiting and diarrhea, it can make the pill less effective and you can still fall pregnant. Then there's the Nuva ring, which is a ring that you put into the vagina that looks like this. And you just push it into the vagina like a tampon. You leave it there for 3 weeks. After 3 weeks, you pull it out, throw it away. You have your menstrual cycle then, and next month you buy another one, and you go on like that. It is a very nice method for women who forget to take their pill. But it is like a hormonal contraceptive. So the same risks that we have with taking the pill in terms of blood clots and in terms of affecting the libido, those are also there. But again, there are many women who use it without any side effects. The Implanon is that thing that you implant into the arm. So it's a tiny little rod. It works very similar to the Mirena, but the hormones are enough that the brain actually picks up that you are on fake hormones, and that stops ovulation. It lasts only 3 years. But there are lots of women who's using it and loving it. There's the injection that you can get every 2 months or every 3 months. Also progesterone like there is in the Mirena, but it is a very high dose. Weight gain is a big issue with the injection, and your period goes away completely with that also usually. But if you then decide that you want to fall pregnant, there can be quite a long time before you can actually fall pregnant. The patch you apply every week, and then for 3 weeks, then you take a break again to have your cycle. It's exactly the same as being on the pill, although they think there's maybe a slightly smaller risk for getting a blood clot if you're on the patch, because it doesn't go through your liver in the same way it does when you take it through your skin. Look, the other thing that you can do is that you can just stay on condoms and use emergency contraception when it's necessary, if you want to keep things natural.
What is the effect of the emergency contraception on your body?
Well, if you ask school teachers, they'll tell you you're only allowed to ever take it 3 times in your lifetime or something like that, which is nonsense. You can take it frequently, but it is a lot of hormone. So if you need to take it like every 2nd or 3rd month, then you need to be on a more reliable method.
I didn't really look into it for my husband, but at some stage we were talking about contraception for him, and there aren't really that many options that I know of.
So the most effective is a vasectomy. And that they're very unlikely to do that for him if he's never had children. The urologist would say, no, rather use female methods first until you are older and you're really 100% sure you don't want to have children.
I heard that it's reversible in other places in the world, but not here.
We do have some surgeons that specialize in reversing it, and they are pretty successful. But even when you reverse it, you don't necessarily then fall pregnant. This is what we would call an irreversible method.
Are there any other methods for men?
They're looking into stuff, mainly hormonal stuff. For instance, if a man takes testosterone, it does decrease his sperm count, but not to a point where it's 0 necessarily. It's not reliable. Although they are researching lots of things, there's nothing else that I can recommend apart from using condoms.
Does Lindy survive the Mirena? Watch her get up close and personal with Dr. Rudolph on her journey to getting a Mirena.
Surfing the wave, all the girls are surfing the wave.